So you've just been told your pregnancy is high risk. Those words can feel heavy, like the air just left the room. But before the fear sets in, take a breath with me because high risk doesn't mean hopeless. It means we're going to be intentional. And when you know what to expect, you can step into this season informed, prepared, and empowered. In this episode, I'm breaking down 5 ways to prepare for your high risk pregnancy, what to do, what to ask, and how to protect your peace along the way. And make sure you stick with me until the end because number 5 is the one that most mamas overlook, but it might make the biggest difference in your outcome. And if you're new here, I'm Dr. Tiffany Woodus, your sister in this journey and a board-certified OBGYN committed to improving Black maternal health outcomes. Around here, we combine medical wisdom, lived experience, and a little faith to help you walk this thing out with confidence. Here's the first thing you need to do to prepare for your high-risk pregnancy. Choose the right provider. This is the single most important decision you'll make because your provider sets the tone for everything that follows. You are not just being interviewed, you are doing the interviewing, sis. This is your body, your baby, and your story. Make sure your provider has real experience caring for patients with your specific condition. Ask about their outcomes. Ask how comfortable they are managing it. Ask what the care team looks like because your provider is only one piece of the puzzle. If they're out of the office, who steps in? Do they consult with a high-risk specialist or a maternal fetal medicine doctor? Is the hospital where they deliver equipped to handle your situation? For example, if you have a placenta previa, that's when the placenta is either partially or completely covering the cervix, or a placenta accreta, where it's abnormally attached to the wall of the uterus. You need to make sure your hospital has an adequate blood bank, a NICU team that's ready, and access to specialists who can step in if complications arise. These details matter because when it comes to a high-risk pregnancy, preparation saves lives. And if you're not sure where to start or what questions to ask, grab my book, The Mocha Maternity Survival Guide, Choosing the Right OB-GYN. It's your roadmap to walking into that first appointment confident, informed, and in control.
These are the worst mistakes Black women can make when choosing an OBGYN, assuming they'll automatically prioritize your safety, ignoring the signs when they dismiss your concerns, and not having a plan to advocate for yourself. Sis, I've been there, and that's why I'm so glad I found the Mocha Maternity Survival Guide, Choosing the Right OBGYN. This guide gave me everything I needed to avoid those mistakes, from conversation starters to tools for assessing their care. It's the ultimate roadmap to make sure you're seen, heard, and protected. Don't take chances with your health. Get your copy today and make the choice that could change everything.
Now, the second thing you need to do is understand, why is your pregnancy even high risk to begin with? Now, this isn't about fear. It's about clarity. The more you know, the better we can work together to protect you and your baby. Your pregnancy might be high risk because of your age, or maybe you have a medical condition like high blood pressure, diabetes, obesity, an autoimmune disease, or an infection like HIV. Sometimes the risk comes from the baby's side, like an abnormal genetic screen or an ultrasound that shows a possible fetal anomaly. That's a concern with baby's anatomy. And other times, it has to do with your anatomy, like fibroids, a uterine anomaly, or a prior surgery like a myomectomy. That's a surgery where we remove fibroids from the uterus. You need to have a real conversation with your provider about what applies to you, because what makes your pregnancy high risk also shapes your prenatal plan, your delivery plan, and your postpartum recovery. Third, and this one's big, you need to understand what your care will look like throughout pregnancy. Let's use an example. Let's say you have diabetes prior to pregnancy. In the first trimester, We'll focus on keeping your blood sugars under wraps because high blood sugars early on can increase your risk for certain birth defects. Your doctor may recommend genetic testing, which could include a simple blood draw like a non-invasive prenatal test, or even something invasive like an amniocentesis. That's when a small sample of fluid surrounding the baby is collected and tested for genetic conditions. In the second trimester, we'll look closely at your baby's growth and development. You might have a fetal echocardiogram, a special ultrasound that looks at your baby's heart to make sure it's forming and functioning well. Then, in the third trimester, we prepare for birth. We talk about how your condition might impact your delivery, how to prevent complications, and how to make sure you and your baby are both thriving. Every stage has its own focus, and when you understand what's coming, you can move through this journey with peace and power.
Think about it. How many hands helped raise you? How many voices spoke life over you? How many arms held you close? Black family is deep, and at Melanin Maternity, we celebrate every single part of it. We're not just a shop for mamas. We're a love letter to the entire village. From keepsake birth announcements that honor your newest blessing, to new dad gifts, to presents for the grandma who still prays over you, we have gifts that tell your family's story. Looking for holiday gear that actually represents us? We got that too, because whether you're the one having the baby or the one making sure the baby always has love, you deserve to be celebrated. Shop Melanin Maternity on Etsy today by visiting melaninmaternity.etsy.com, because our families, our stories, and our legacies deserve the spotlight.
Now, the fourth thing to know is that high-risk pregnancies usually come with extra eyes on you and your baby. That means more frequent ultrasounds and something we call antenatal testing. That's testing done while you are still pregnant to check in on your baby's well-being. You might hear terms like biophysical profile, which is a limited ultrasound that looks at things like your baby's movement, breathing activities, and the amount of fluid around them. There's also something called a non-stress test, which is where we watch baby's heart rate over time to make sure that it responds normally. If there's concern about blood flow through the placenta, we might do a Doppler study, which is a special ultrasound that checks to see how that blood flow is moving through the umbilical cord. These tests help us answer one big question. Is it safe to keep this pregnancy going, or do we need to step in early to protect mom and baby? So when your OB recommends extra monitoring, remember it's not to scare you, it's to safeguard you. And here's the fifth most important thing to prepare for: how your condition might impact your delivery. You and your provider should talk through things like, will I be able to have a vaginal birth? Should I be prepared to deliver preterm? Is a C-section safer for me and my baby? Are there risks for bleeding or infection? What can we do now to prepare for these possibilities? For example, if your condition increases your risk for hemorrhage, you can start early by building up your iron stores, optimizing your hemoglobin, ensuring that your hospital is equipped with the appropriate blood bank and emergency protocols. If your baby might need extra care after birth, ask to meet with the NICU team ahead of time. Find out if your hospital can handle your baby's needs so you don't risk being separated from your baby after delivery. And most importantly, choose a provider you can trust, someone who will walk you through the highs and the lows, who will advocate for you, and who will not let fear have the final say. So here's what I want you to take from this. A high-risk pregnancy doesn't define you, it refines you. It reminds you that preparation is power and faith is the anchor that holds you steady when things feel uncertain. God did not bring you this far to leave you, and even in the middle of the tests, the extra scans, and all of those doctor visits, you are not alone. If you want to go deeper, join me inside the Melanin Maternity community, because your 15-minute prenatal appointment is not enough. There is a whole village waiting to walk this thing out with you at melaninmaternity.com. I'm Dr. Tiffany Woodus. Thank you for trusting me to walk with you on this journey. Until next time, stay informed, stay empowered, and keep your faith strong.
Want to go deeper? The conversation doesn't have to stop here. Join Melanin Maternity, our digital Black birth community, where you'll get expert guidance, real support, and a sisterhood that sees you. From live Q&As with birth experts to empowering discussions with other Black mamas, we've got you covered. Click the link in the description and step into the community you deserve.